Well, good afternoon, everybody, and welcome to this session. My name is Valerie Sadler, and I'll be your moderator. I'll start with a land acknowledgement. Halifax is situated in Mi'kmaq, the ancestral and traditional lands of the Mi'kmaq people. The plan is to have each of the groups speak for 20 minutes, and then we will save the questions for the end. So I'm happy to introduce the first group. The presentation is responding to pregnancy and homelessness through temporary housing and wraparound supports. Our presenters are Mary Vaccaro from McMaster University School of Social Work and the YWCA Hamilton, and Chelsea Kirby from the YWCA Hamilton.
Okay, so hi everyone. Thanks so much for having us today. We're excited to be talking to you about our reproductive health care programs at the YWCA Hamilton. So I'm Chelsea Kirkby. I'm the Vice President of Strategic Initiatives and Program Development at the YWCA. And this is Mary. I'll let her introduce herself.
Hi, I'm Mary Vaccaro, a faculty member at the School of Social Work with a course release to support program development and research at the YWCA.
And I'm just presenting on behalf of our colleague, Amy Deschamps, who's the Director of Housing and Gender-Based Violence at the YWCA Hamilton, who wasn't able to make it today. So today we're hoping to gain a better understanding of the complex and unmet needs of people experiencing long-lasting homelessness and pregnancy. We're hoping that we're able to learn about how the YWCA Hamilton responded through developing an emergency reproductive care program. And this includes transitional support beds and a mobile worker that we'll get into in a moment. And we're hoping that we also provide an opportunity for you to understand how you might action a model of support for pregnant people experiencing homelessness in your own organization. We're going to fall off the stage.
So I'll just share a little bit about how we came to this work. And it really was during the COVID-19 pandemic that we began noticing at YWCA an increase in people experiencing pregnancy and street-level homelessness. And this was being echoed across the sector of women serving organizations in Hamilton. We began this work by consulting people with lived experience, people who had experienced pregnancy and homelessness, on their ideas for what a program or what a response could look like. In May of 2021, we facilitated a call to action on pregnancy, homelessness, and reproductive care. And by doing this, we brought together community partners and academics, and this is now an annual event that guides our work together. And we really were hoping to develop an intervention that would respond to what was really a lack of support at the intersection of homelessness, pregnancy, and gender-based violence for many of the people that we were seeing and supporting at YWCA. And our program really responds to the unmet needs of people experiencing pregnancy and other complicating factors such as long-lasting street-level homelessness, gender-based violence, substance use during pregnancy, experiences of trauma and mental health, incarceration, and past experiences with child welfare organizations that prevent people from wanting to access prenatal care in fear of having that situation repeat itself.
Okay, so I'll share a little bit about how we developed our approach. So phase one involved quite a bit of advocacy, as well as building partnerships across our community in Hamilton, and then also meeting urgent needs, so making sure that we were acting quickly and responding to what we were seeing happening. And this phase one took about a year to get through before we were able to really develop a program that's now more longer lasting and hopefully we can build on. So with regards to the advocacy, as Mary mentioned, we did a call to action with key stakeholders. This included community partners, those working in hospitals with pregnant people in the community, as well as some of our government officials, particularly at the municipal level in Hamilton. We also wanted to quantify the issue, so we did some data collection. We had an idea. We anecdotally were seeing more pregnant people who are homeless, and we were intersecting with them through our work. And so we wanted to make sure that we were actually counting those individuals, seeing what the actual scope of the issue was before we decided how we'd respond. With regards to partnership building, we partnered with different organizations that were working at the intersection of reproductive health and justice. So those working with pregnant, homeless individuals, those who are working with pregnant folks who were using substances, those with pregnant people who were involved with Children's Aid, all different folks across the community. And then we also identified what resources existed and what could be leveraged. So through those partnership discussions, we really found out what was already existed. Learning about what people were doing, we find that there's a lot of disconnect sometimes where we don't actually know all the things that are happening in the community, so connecting all those dots. And then we also documented low barrier care pathways to see, so that we could share amongst the community ways you can access service, ways individuals could access the service that they needed. And then with regards to meeting urgent needs, we had an on-site midwifery care clinic. We temporarily set that up to try to meet a need for the pregnant people that we were serving. We made reproductive health supplies available, so that was a really quick thing that we could do within our programs and our services, particularly at our site where we have transitional living and a drop-in shelter. And then we also enhanced sector knowledge on reproductive care needs. So we made information available and made those kind of referral sites available as well, so folks knew where they could send people who had some needs in this area. This is, oh good, it's nice, it's bigger on there, it's quite detailed, but this is our our diagram of our call to action from 2023, so earlier this spring we did this, yeah. And we had an artist note taker who put this together for us. So is it on our website? Yeah, it's on the YWCA Hamilton website if you want to look at it more closely, but it is a nice diagram to show all the various needs and what came out of the conversation that we had with our stakeholders. So just an interesting way to present the information, but I won't go into the details on that slide. So phase 2 was the implementation of the emergency reproductive care bed program. So through that phase 1, the advocacy, the partnership development, we decided what was needed, and what came out of that was care, wraparound supports, and basic needs. So with regard to care, we were able to second a full spectrum doula. So that's in partnership with Birthmark. Oh, I meant to say at the start of the presentation, this is a project with Birthmark, which is an organization based out of Toronto and Hamilton that provides full spectrum doula care, so prenatal as well as abortion care. And then the YWCA Hamilton, which is a multi-service organization serving women and gender diverse individuals in Hamilton, everything from employment, housing, childcare, health and wellness, gender-based violence, a broad range of supports and programs that we offer. Anyway, so we seconded this full-spectrum doula with Birthmark, and their title is the Emergency Reproductive Care Mobile Worker. And then we also developed a suite of in-house and mobile supports. So they were able to provide system navigation, case management, that type of support. And then we also had wraparound support. So we wanted to integrate and collate these community wraparound supports within our programming that existed, particularly in our transitional living program, where we have reproductive health care beds that I'll get to, as well as in our drop-in shelter. So where we were seeing these pregnant people who were homeless and or in our shelter system or our housing system, we wanted to be able to have very easy access to programs and services. And then basic needs. We also want to provide low barrier pathways to prenatal care, access to basic needs, rest, food, support, and connection. So as I mentioned, we had reproductive health care beds, so folks were able to have a place to stay. They could get 3 meals a day. They could have their basic needs met through our housing programs, and then they would be able to be connected out to programs and through our partner organizations as well. This is just an overview of what the program looks like. So you'll see on the left-hand side, right-hand side, the emergency reproductive care beds. We only have 3 right now, which are beds that are held and prioritized for pregnant people who are coming out of homelessness, experiencing homelessness. And in there we provide prenatal and postpartum care, so it's a safe temporary accommodation during the prenatal and the postpartum period. And I just want to put a caveat there that is the postpartum period if they do not have their infant in their care. So this is not a transitional living program that accommodates infants. So if someone is going to be having their infant in their care, we support them to move into a location where they're able to support that. So that's a gap in the housing at the YWCA and housing kind of across transitional living, like across the sector right now. It's really difficult to find that, and we're working on it to make that available as well. And then the abortion care beds. So that's a safe temporary place to rest postpartum. So both medical or surgical abortions, folks can come in and have some respite within these beds. But there's only 3. So there's not enough. We need to have more of this available in our community, and like I said, we're working towards that. We had 52, we've come into contact this year, connected with 52 pregnant people who were experiencing homelessness in our community this year, with, what was it, 12, 13, 12 that were able to access our beds just because of the, people don't stay for super long time all the time. And then the rest were served through our mobile care, which is on the other side here, the Emergency Reproductive Care Mobile. So that's connection to prenatal care, practical support, case management, service navigation, really meeting people where they're at. And so that's where we can extend out and ensure that we're at least offering support and connection to those who may not be able to access our reproductive care beds. And so just a quick note on our program values. So we do work from an intersectional feminist analysis. So we believe that, impressive institutions create systemic barriers that really do have an impact on reproductive rights, choices, and experiences. We work from a harm reduction approach. So our work is really explicit in its commitment to supporting women and non-binary people who use substances and focused on providing options to reduce the harms associated with substance use during pregnancy, as well as into that postpartum period. We're pro-choice, so we're really explicit in our commitment to supporting people who choose to access abortion supports, and we really aim to reduce those barriers to abortion or people who face barriers to access. So we always provide the full range of choice and make sure that folks know what their choices are so they can make a decision. Gender inclusive, so trans and non-binary people experience pregnancy differently, and they require unique services and supports during that prenatal and postpartum period as well. So our services are inclusive of trans and non-binary folks as well. And low barrier. So we try our hardest to create low barrier pathways for services that prioritize the access to basic needs. So as we said, food, housing, safety, to do whatever we can to really enhance the prenatal, postpartum, and post-termination supports. And we do this through partnerships. That's the strength of this model, is that we do have community partners that we connect with and that have helped us build out this model and provide a range of supports for folks. So Birthmark, as I mentioned, they provide full spectrum doulas, including the abortion doula care. We also work with the Hamilton Social Medicine Response Team. So they provide safe supply that prioritizes pregnant women. We have the program for pregnancy and substance use, so they provide addiction care and prenatal care. We work with McMaster, and that's out of a clinic, a more hospital-based. And then McMaster University is research and evaluation component. We work with the Hamilton Outreach Midwifery Team, so they do outreach midwifery care. So they're out, working in encampments, working with folks who are living on the street and are able to connect in with them. And then the Greater Hamilton Health Network, which in Ontario, our health system has been all reshuffled, and so we have these new Ontario health teams that work in different jurisdictions. So ours, the Greater Hamilton Health Network, works with our system planning and advocacy, and they've been really key in helping us with our pathways and creating different pathways and understanding what resources are available and how we can connect folks. So I think, Mary, if there's anything you want to add, feel free, and I'll pass it over to Amy to look at our first year of operations. Sorry, Mary, Amy, because Amy was supposed to be.
So I'll share just briefly about our first year of operations. And so we opened this program pretty much exactly a year ago. And in that year, we've had 52 people referred for services and support. 39 of those have accessed the mobile supports, and 12 have accessed the emergency reproductive care beds. A little bit about the people that we are serving through this program. So all participants in this program have experiences of long histories of homelessness and unstable housing. They would sort of fit the definition of chronic homelessness. Over half of the program participants have shared with us that they were actively using substances during the pregnancy. Experiences of gender-based violence have impacted every single participant, and we see that happen in multiple ways, and we also see the risks of violence increase during pregnancy. The majority of referrals have not had any prenatal care prior to being referred to our program. So that's a key piece of Christine's role, who's the emergency reproductive care worker, is supporting people to start accessing prenatal care and build some sort of trusting relationship with some care provider who can provide that. We are still thinking about our outcomes and our program evaluation since it's been just 1 year so far. I think it's important to note that many of these women who we are supporting, our main outcome was that there was an increased retention in prenatal care and an increased retention on safer supply. Many of the folks that we are supporting have complicated life experiences, and meeting basic needs for this population was an outcome of our program. Although I'll get on to what happened with the babies next, but many children did get apprehended at birth. However, we worked to support the mother postpartum in ways that I think without this program, she just wouldn't have been available to her. So it serves as a point of connection, an accompaniment to referrals, accompaniment to appointments, support, case management, advocacy with other services, particularly advocacy with child welfare services. So in this past year, 15 babies have been born in total of people that we have still stayed connected to. 4 of those babies were apprehended at birth. 5 were able to go home with the mother. As Chelsea noted, that is a huge barrier for our program because they can't return to these beds with the infant. These beds are housed in a 60-something unit transitional housing program for single women, and so we can't have babies there. But 5 were able to be go home and find some sort of permanent housing but for when the baby arrived, which was, it was difficult, and it actually relied on us moving people to other YWCA buildings that babies could live at. And so now I just want to share a little bit about actioning this in your own work and developing pathways for pregnant people in the homelessness serving sector. So we were able to do this really within an existing program. So as Chelsea shared, this exists in an already built transitional housing program. And so what we did was we prioritized space for people experiencing pregnancy. We have only prioritized 3 beds at this time, but we are hoping to enhance and increase that. So after we decided that we would prioritize space, it became so important for us to build partnerships with reproductive care providers and full spectrum doulas and other providers who could help us to develop this suite of wraparound services that we are trying to support people with. I think our partnership with Birthmark and the lens of having a doula in this work has been really special and added something really unique, I think, to the work and the ways that people are feeling supported, I think, in that program. We spent a lot of time doing systems planning with partners to leverage existing resources and to create clear pathways to services and support. As Chelsea said, there was so much happening that even the people working in the sector didn't know. So how could we expect people to figure it out on their own, particularly around the abortion care access? We worked with municipal officials and community partners to ensure that people who are pregnant were being prioritized within other services as well, particularly for ICM, intensive case management, and housing first supports. And collecting data. So that was one of the biggest things that we had to do in that first year, was try to quantify this as an issue to people who wanted numbers and us to tell the story with numbers instead of the stories that we were seeing and people we were supporting. I'll just reflect on a few lessons learned. So we opened this in an existing gender-specific transitional living program. So it is possible to do this if you have existing space already. Strong community partnerships were essential. We have a really good partnership with Birthmark, and as well this program called Prosper, which is the program for substance use and pregnancy. So both of those programs have allowed us to do this work. We believe that municipal systems need to prioritize pregnant people within the emergency shelter system and into affordable and supportive housing stock. This is a huge barrier for us. So there needs to be emergency shelters and permanent housing where these babies can transition into. And if you're thinking about doing this in your work, make sure you're collecting data on pregnancy, because this became a crucial part of our advocacy and a bit of a stumbling roadblock for us as we were doing the early organizing. So where are we going from here? So we're working on a SHIRK Partnership Engage grant that investigates housing and support models for people experiencing pregnancy and homelessness who are at risk of newborn apprehension from child welfare organizations. So this research project has two components. The first is interviews with people who are experiencing or have experienced pregnancy and homelessness, who've been at risk of newborn apprehension. And the second is to look at housing and support models that exist across Canada and in other parts of the world, so we can try to develop a model that might work in Hamilton, as we hope to scale up from our 3 beds. And YWCA Oakwood Place is a forthcoming housing build by YWCA Hamilton that will offer a continuum of housing and supports for people experiencing homelessness, GBV, and pregnancy. And it will be a space where people can parent as well, which will help us to address some of the gaps that we're seeing at our current location. We strongly believe that there needs to be more trauma-informed supports for people who experience child apprehension. We think that this is, it's a huge gap in the system and something that we're really noticing impacting the women that we're supporting. We believe that we're going to be working towards building out supports for women and non-binary people who are incarcerated and pregnant, which is critical, I think, in our work. And advocacy for prioritization of pregnant people for temporary and permanent housing options. So we're working on a few different things to try to scale this program up in a way that addresses some of the barriers that we're seeing in our small current model of it. So thank you so much for your time.
Thank you, Mary and Chelsea. Our next presentation is intersections between homelessness and women with animals experiencing gender-based violence. ACT, Awareness, Collaboration, Tools to Keep Families Safe. All 3 of our presenters are from Humane Canada, and they are Sue O'Neill, Claire Delude, and Andrea Andrade.
Okay. Hello, and welcome everyone to the Act to Keep Families Safe presentation on intersections between homelessness and women with animals experiencing gender-based violence. So as a remote work environment, the ACT project team would like to acknowledge the many Indigenous nations that have long-standing relationships with the land across Turtle Island where our work takes place. The project team acknowledges our presence on the treaty lands and territory of the Mississaugas of the Credit First Nation, as well as the traditional territory of the Anishinaabe, the Chippewa, and the Haudenosaunee and Wendat peoples. Additionally, we'd like to acknowledge our presence on the traditional, ancestral, and unceded territory of the Mi'kmaq people. We're grateful to have the opportunity to work together from all these different places. So before we start, I'll just introduce us. My name is Claire Delude. I go by she, her pronouns, and I am a coordinator for the ACT project. And beside me here are Andrea, who is also a coordinator for the ACT project, who goes by she, her pronouns, and Sue, who goes by she, her pronouns, and is the ACT project manager. And we'll start with a few reminders. First of all, being that language is very important, and so is maintaining a space of openness to learning. As we review, the language that we define is important to remember and use in our discussions. We know language can be misused and mistakes can be made, and so we encourage an openness to learning from our mistakes. In the ACT project, we like to say we are humble and ready to fumble. We'll be using language shared with us by Women at the Center, which is a national survivor-led organization that's one of the lead partners of the ACT project. And this language includes survivors instead of victims, declarations instead of stories, reported instead of alleged, aggressor instead of perpetrator, and accomplice instead of ally. We're also conscious of our imagery today and want to contextualize that we intentionally use imagery to represent the many different kinds of animals that survivors may have a relationship with or be responsible for. And we're conscious that some of these images may not necessarily represent best practices regarding animal welfare, such as the keeping of an animal which might be considered a wild animal. But we want to ensure that no survivor voice is left out regardless of the kind of animal they have. We also want to acknowledge the survivors in this space with us today, those who self-identified and those who have not. We recognize some survivors in this space might be representing their sector while also holding their own survivor history. We appreciate the contributions you've brought to this work, and we're here if you'd like to debrief or chat after this session. And we also want to just say, please do be mindful and self-monitor. We are talking about a complex and a potentially triggering topic today, so please respect your own needs. We encourage you to stand and stretch, take breaks as you like, and just be kind to yourself as we collaborate. So after this presentation, you'll be able to describe what the violence link is, identify barriers to survivors securing safe, affordable, animal-friendly housing, and be able to access the Act to Keep Families Safe model to further your advocacy and collaboration work to prevent homelessness for survivors of gender-based violence and their animals. So I'll explain why this project came to be. We know this is important because we know that more than half of Canadians have at least one pet in the home, which means there must be a significant portion of survivors of gender-based violence with at least one animal that are confronting a system that does not include or support survivors with animals. And we also know that COVID-19 increased animal adoptions and also really exacerbated the effects of social isolation. So what is the violence link? The violence link is the strong link between animal violence and human violence, and there's an overlap between animal abuse and other forms of violence, such as intimate partner violence. And in instances of domestic violence where there are animals in the home, higher reports of animal abuse are documented. And that brings us to the ACT project. So the ACT project is a 3-year project funded by Women and Gender Equality Canada. And Humane Canada secured this funding so that the ACT project could be created to address systemic barriers faced by survivors of gender-based violence and their animals. Before we go any further, we just want to take a moment to acknowledge the foundational work of the folks that were involved in the project before the project really even began. So there was some really fundamental research that was performed by researchers Dr. Amy Fitzgerald, Dr. Rochelle Stevenson, and Dr. Kendra Coulter. We express our sincere gratitude for the work these researchers did with survivors and their animals that really underpins what we've been able to do. We also want to acknowledge the foundational work of Jasmine Ferreira, a PhD candidate at York University, who was the previous manager of the ACT project, and she created the foundation from which this project was built and collaborated with our stakeholders to create the ACT to Keep Families Safe model. I'll pass it to Andrea.
Thank you, Claire. So the objectives of the ACT project are to raise awareness and increase communication about the violence link with key stakeholders in survivors' lives, to develop and implement an adaptable collaborative response model, or an ACRM, that can be used across sectors and can be adapted to support underrepresented groups of women. So that includes Indigenous women, survivors, the official language minority community, and survivors residing in rural and remote communities. We further consulted with other underrepresented groups, including immigrant and refugee women, and people within the 2S LGBTQIA+ community. So really trying to get a variety of lived experiences to inform this model. Our third objective is to provide education, tools, resources, and access to the model to sectors directly responding to survivors experiencing GBV, specifically through providing an online learning center and regional workshops. We are completing the program objectives largely in part due to our 40 partners across the country. This is an inclusive infograph of the animal and human service organizations that we've worked with to complete this project. And because of their support, and specifically in our consultation and collaboration with them, their contributions helped build the Act to Keep Families Safe model. Our collaboration with these partners allowed us to integrate a variety of multiple perspectives, and it also reinforced the need for collaboration across sectors to create better programming and supports for survivors and their animals. As mentioned, this is the Act to Keep Families Safe model, built with the support of our partners. The model offers resources, education, and tools for organizations and champions to build or expand upon animal safekeeping programs that support survivors and their animals. Sue will share more about the model later on in this presentation too. So we have partnered with survivors of gender-based violence who have or had animals. And from that perspective, there can be challenges in leaving abusive relationships, as well as barriers to accessing animal-friendly shelters and housing. There are complexities to leaving a violent relationship for a survivor and with an animal. The decision to leave a violent relationship is difficult. Survivors may depend on their aggressor for housing or be financially dependent on them. Their finances may be intertwined and leave them more vulnerable to financial abuse. They may also fear an escalation of violence if they do leave, and if there are children, concerned for their safety as well. And leaving is made further complex when considering the needs of the animals in a survivor's life. So survivors can experience challenges in accessing animal-friendly or inclusive shelters and services. The bond between a survivor and their animals may cause them to delay or reconsider leaving as well. The aggressor can use that bond to coerce and control, and in some cases, they threaten harm against or actually harm the animal to control the survivor or prevent them from leaving. So when a survivor does leave, there are additional barriers to accessing animal-friendly shelters or on-site sheltering options. We know that few emergency shelters are inclusive to animals, nor do they have the placement options for animals. So in 2018, only 1% of Canadian domestic violence shelters provided on-site sheltering for companion animals. This is a major barrier to survivors who must choose between safety and leaving their animal behind with the aggressor, where they may be concerned for the safety of the animal or giving them up entirely. For off-site sheltering options, these programs usually tend to be short-term, and individuals fleeing violence and abuse may not know the exact amount of time they will need for their animals to be in care. And they may not have other housing options once that time limit is met. And once it is met, survivors can experience precarious housing or homelessness. Further, off-site sheltering is not an ideal option for survivors because they might not be able to visit their animals depending on the program, and being separated can create worry about their animals and also leave them without that key emotional support and companionship that animals can bring to their lives. We know that survivors have described pets or animals as important as children, and research has further shown that animals can suffer emotional trauma, and that separation can create further trauma for both people and their animals. The ideal solution is on-site sheltering or animal safekeeping programs so that survivors can be with the whole family, but we're also mindful that organizations have noted their own barriers, and that can include lack of resources, funds, staffing, training, and more. So looking at survivors with animals accessing animal-friendly housing, there are additional barriers as well. There is no clear standardized approach to housing across Canada for the allowance of pets in homes and shelters. In 1990, Ontario prohibited no pets clauses in rental contracts. So that means that a landlord cannot prohibit the presence of pets at the premises. And the same cannot be said in other provinces and territories. But even in Ontario, when survivors attempt to access safe and affordable housing in Ontario, they may still experience discrimination from landlords, where landlords can simply put up a post that says no pets. They can choose not to accept those applications and refuse housing to the survivor. In addition to the rising cost of housing that we're seeing, the lack of safe housing, survivors with animals will experience a lot of difficulty in finding appropriate housing because there are limited options out there as well. And that further keeps survivors with animals stuck in violent and dangerous situations. Looking at the impact of barriers, so these barriers can create life-changing situations for both survivors and animals. As mentioned before, the lack of animal-friendly or inclusive sheltering and housing can create a situation where survivors have to make this impossible decision and delay leaving, or they don't leave at all and have to remain in an abusive relationship. Survivors and their animals may further experience trauma from staying, or if they do leave, from being separated from their animals temporarily or permanently. Survivors who do leave, and even survivors who are able to access services, may experience being precariously housed or unhoused, as the length of programs for survivors and their animals may not be an adequate amount of time for them to secure safe, animal-friendly, affordable housing. Through the ACT project, we were able to gather and privileged to hear stories from survivors, and we've included those direct quotes onto the info sheet that was handed out. So we encourage you to have a look at the sheet, the quotes, as it really shows the reality that survivors with their animals face when leaving violent situations.
Thank you, Andrea. Sorry, I'm the tall one. So how do we create solutions for survivors and their animals? Thank you. How do we create solutions that actually support survivors and their animals and their needs while mitigating the trauma of being separated from their animals, and offer other options for long-term safety and housing? I will label, we do not have all the answers, but in this project we have found strategies, innovative solutions, and ideas that other organizations and champions can learn from to be able to design their own programs or expand upon animal safekeeping programs already existing in their communities. The importance of advocacy, both within community as well as to larger audiences like the federal government, cannot be underemphasized. Advocacy is needed to create change to be able to better support survivors. One of the ways that the ACT project is advocating for long-term solutions to support survivors and their animals is through putting together a submission for the Federal Housing Advocate. We're advocating specifically regarding the need for animal-friendly housing. We also encourage organizations, champions, and survivors to submit their own experiences and recommendations to the Federal Housing Advocate. We encourage, if you are going to complete a submission, we encourage you to build your submission in a meaningful way that includes the voices of your clients. And I do want to label, anyone can submit a report to the Federal Housing Advocate. In our report, we were informed by research, the responses we received in our survivor survey, and from case study interviews we did with organizations, but we really wanted to emphasize and center survivor voices. I also want to label, on a local community level, we encourage organizations and champions to advocate to landlords, municipal governments, on the need to have animal-friendly rental options to support survivors of gender-based violence and their animals. And it's also really important to emphasize again, many individuals feel the bond they have with their animals is their strongest support, and animal-friendly housing would support more than just survivors of gender-based violence. As Andrea highlighted, this work cannot be done alone. Gender-based violence organizations offer co-sheltering. Gender-based violence organizations that offer co-sheltering have highlighted it to us time and time again that their co-sheltering programs were successful because of the partnerships that they have built in their community with other organizations, from animal welfare and animal services to human services. This is also what we hear from off-site animal safekeeping programs. Cross-sectoral collaboration is what is needed to build programs that actually support survivors and their animals. And the ACT project is a perfect example of that collaboration. Our 40 partners work together with numerous roundtables and workshops and community conversations to design the ACT to Keep Families Safe model. Without the input from each of these organizations, the model would not have been able to be created. The perspective of both human and animal services, as well as survivors, is integral to building programs that meet the ongoing needs of survivors and their animals. And I'm going to label an opportunity for you to network and build partnerships, and that's through the ACT to Keep Families Safe community of practice. These are quarterly meetings that offer an opportunity to learn from speakers on a particular topic for the first hour, and then 30 minutes of regional breakout rooms with a facilitated discussion to be able to network and build your own partnerships with other organizations in your region, hear about successes, and discuss challenges that are happening in that space, working with survivors and their animals. And if you are interested in joining us for our next community of practice, which is in January, please check out the Online Learning Center for more details or the QR codes on the back of your handout. So now's the fun part. I get to actually explain our model. So this is the ACT to Keep Families Safe model, and it's designed to support organizations and champions in building their animal safekeeping programs, as well as learning how they can best support survivors and their animals, even if you're not an animal sheltering or gender-based violence sheltering organization. There's also something in the model for survivors, the general public, really something for everyone. So the model is made up of 6 building blocks, and I'm just going to briefly explain all 6, but you can locate the model on our Online Learning Center where you can learn more. The first building block is tools and templates, which offers policies, educational resources, awareness resources, all in one place in a resource library. Then there's the outreach and awareness building block. That is, we have, again, resources as well as a toolkit to help you with your own outreach and awareness practices. Then there's the networks and partnership building block, and that's where we have our community of practice located, but we also have a collaboration guide that's being built to help you build your own relationships. Then there's the advocacy building block, which offers strategies for developing your own advocacy policies as well as advocacy resources. Then there is the case studies building block, where we have case studies from organizations across the country that are already doing this work to offer ideas and inspiration for how you can do this in your own communities, as well as the stories of survivors to showcase the strength of survivor voices, as well as the reality of the situations that survivors experience. And the final building block, our education and training building block, which offers 11 asynchronous modules on a range of topics to learn about how to best support survivors and their animals. So this model, like I said, as well as the resources, tools, education, can all be found on our ACT to Keep Families Safe Online Learning Center. This Online Learning Center just expands upon that model and offers a space for organizations, champions, and survivors to learn, explore, and grow. We really appreciate your attention today, and before we wrap up our presentation, we do want to highlight a couple ways that you can be involved in the ACT project. So I'm going to start by saying that little QR code there, that offers you the opportunity to give us feedback on this presentation through a word cloud. We highly encourage you to grab out your phones and take a picture so that you can give us some feedback. You can also sign up for the ACT newsletter, which is a quarterly newsletter on new resources, education opportunities, as well as we highlight the incredible work being done by our partners. We also have the community of practice, which I feel like I've said 14 times, so please come. We'd love to have you. And then finally, sorry, everyone. Finally, the ACT to Keep Families Safe Online Learning Center. We highly encourage you to participate in the modules as they launch in the next few months. So Thank you so much for your attention today. We hope to see you at our next community of practice. And also, if you'd like to connect with our team, please email us. Humane Canada is also on social media, and we encourage you to follow us for updates about the ACT project, as well as the incredible work that Humane Canada is doing, and let's be real, cute animal pictures. So thank you all.
Thanks so much, Sue, Claire, and Andrea. Our next presentation is developing a safer drug use space in a low-barrier drop-in program for women, trans, and non-binary people at the YWCA Hamilton. Our two presenters are Stephanie Milliken from the Y and Mary Vaccaro from McMaster University School of Social Work, as well as the YWCA Hamilton.
That. There we go. And now it should work. Yes.
Thank you so much.
Hi.
How did that happen? I don't know why it does that. I hate that mouse. Okay, let's just get rid of that. Where did that get from? I have no idea where that come from. I want your clothes. Sorry about that. There we go. Okay, what am I trying to cross here? More. There we go.
Thank you.
There we go. All right, sorry about that.
Thanks. Hi, everyone. So my name is Steph Milliken, and I am a frontline harm reduction worker at YWCA Hamilton in our safer drug use space, and I'm also a first-year PhD student at McMaster University in the School of Social Work. And this is Mary. You've met Mary? Yes. Yes. And we're going to be presenting today on how we have developed and run for the past year and a half or so our safer drug use space in our low barrier drop-in program for women, trans women, and non-binary people at YWCA Hamilton. This is a partnership between YWCA Hamilton, Keeping Six, which is an advocacy organization by and for people who use drugs, and HamSmart, which Mary and Chelsea did talk about in their presentation as well. It's a Hamilton social medicine response team. So in this presentation, we're going to just give a brief overview of our understanding of developing an intervention at the intersection of substance use, gender, homelessness, and gender-based violence. We're going to
try to learn today a bit more about our model of operating a safer drug use space in a low barrier overnight and daytime drop-in program. We're going to share some of the transformative ways incorporating this particular service into a low barrier drop-in has shifted the ways we support women, and this is inclusive of cis and trans women, two-spirit and non-binary people who use drugs. And we're going to talk a bit about how and why you can action a similar model in your own organizations. So it's important to note that our safer drug use space is really an intervention at the intersection of gender, homelessness, gender-based violence, and we have a gendered lens to the work that we do. And to our understanding, we're the second gender-specific safe consumption space in the country. We wanted to begin, we wanted to do something along the lines of a safe consumption site because we were noticing a huge increase in the toxic drug poisonings that were happening at YWCA Hamilton. So just a little bit about YWCA. So YWCA Hamilton is located in the downtown core of Hamilton, Ontario. It's a multi-service building with lots of different programs and services, but we have 68 transitional housing beds for single women experiencing homelessness and our gender-specific low-barrier drop-in program that's open every evening from 10 p.m. into the next day until 1 p.m. Really serving folks who are not well served within traditional emergency shelter services. So prior to opening our safe consumption space, we were calling emergency medical services for drug poisonings or overdoses about 5 to 7 times per week for those two programs. Staff were responding to drug poisonings that were happening in hidden spaces, both inside and outside our building. So we were, finding people in the washroom that had been unconscious for a long period of time. We were responding to drug poisonings happening across the street from our building. And so we really wanted to obviously develop something to respond to that. Okay. And we know that people who use drugs and experience homelessness will use in public or will use traditionally in hidden spaces, and this really increases the risks of drug poisoning and not being found. We know that women are often erased from public narratives of who uses drugs and who experience homelessness. And there's also research to suggest that women often do not access co-ed safe consumption spaces because of their experiences of violence and their wish not to be using in a co-ed mixed gendered space. When supports for people experiencing homelessness don't operate from a harm reduction framework, we know that the ability to use life-saving intervention is limited and the risk of equipment sharing, infection, and death increases. So by developing our safer drug use space at the YWCA, we really wanted to bring people who were using drugs together in a way that would promote safety in a way that organizations just haven't done before, or our organization hadn't done before. So we're just quickly to talk a little bit about using a harm reduction framework combined with a lens which takes into account the specific complex needs of women and gender diverse people. So as Mary said, research suggests, as well as statistics from consumption treatment services suggest that women who use drugs access supervised consumption spaces less frequently than men. And when we ask ourselves and people who use drugs why that might be, certain concerns come up, such as the potential for the involvement of CAS and CCAS if someone is seen to be somewhere where you are meant to be using some substances in a supervised way, right? People, I'm sure I don't have to explain to this group that people who have prior negative experiences with CAS and police and things like that, they're not going to want to go somewhere where they're surveilled, right? And then there's also a lot of judgment in our society towards pregnant people who use drugs. And this is something that when they go to larger consumption and treatment services programs, because they're very medicalized, it's often a fear that people will judge them if they could be pregnant. And then for sex workers to go to an all-gender consumption treatment services program might bring them discomfort or some fear because they might be around Johns or clients. And there's also a higher risk of violence and coercion experienced by women who use drugs. First, sometimes substance use comes along with experiencing gender-based violence from a perpetrator or someone who's abusing you. They might use substances, but also when you use substances yourself, you could become more vulnerable as well. And then using in a space where men are not there removes you from the male gaze, and that can increase your feeling of safety as well. Because I work as a frontline worker in the safer drug use space, I know that many of our clients, they inject their drugs in different parts of their body, and some of those places are parts of your body that you don't necessarily want everyone to be watching you doing that, right? And then we have one all-gender safe consumption program, a CTS, in Hamilton. It's called Urban Core, and we just have a few of their, like a little snapshot of their stats for the month of September. And you can see that men access their service almost twice the amount that women do. And so I recently finished my master's in social work, and I did a research project with some of our regular clients at the safer drug use space, just talking about the first year of the program and what their experiences have been. And this is just a quote from one of the people I interviewed, and this is a pseudonym, Christy, but she said there was this one girl who came in whose boyfriend had pitched a tent right across the street in the sidewalk and was waiting for her, and she described the safe use space as a safe haven for them to go, for people to go if they're experiencing violence outside, to get away. Thanks. So I'm going to share a little bit about our approach to designing the safer drug use space at the Y. So that's a picture of our room. And again, our partners on here, but we don't have an exemption like a consumption and treatment service as a full CTS. What we have is called an urgent public health needs site exemption. And this came through the Canada's Controlled Drugs and Substances Act. If you're interested in it, it's 56.1 exemption under Canada's Controlled Drugs and Substances Act. This was introduced during COVID, but it's still available to organizations who want to apply. And this was intended to be a short-term intervention during COVID to help communities reduce the harms associated with substance use while also respecting public health guidelines. It is the exemption that allowed a lot of COVID hotels to set up some consumption spaces quickly in those spaces to ensure that people who use drugs could do so, and that the organization wouldn't be essentially, doing something illegal, I guess. But the exemption allows shelters and similar sites in communities to quickly establish temporary overdose prevention sites if they demonstrate what's an urgent public health need. So I'll share a little bit more about the application process at the end, but it was a really simple application. It's about a page long. You write in there why you believe what's happening is an urgent public health need. So if you have data, if your organization's collecting data on the number of times you're calling EMS, number of drug poisonings happening in your space, those are all the sorts of things that need to go in there. But unlike a CTS application, you don't need to do a community consultation, and it's a much easier process. So we wanted to integrate a model of safe consumption in a space that was already responding to multiple drug poisonings and overdoses. We also wanted to operate overnight when all other spaces and programs that support people who use drugs are closed. And we wanted to develop a gender-specific space that offered trauma-informed supports, recognizing the link between gender-based violence and substance use.
So a few of the services, programs, things we offer at the Safer Drug Use space, on top of being a space for people to use their substances while being supervised by YWCA staff and Keeping Six peer support staff, is coordinated care pathways to support access to detox treatment and opioid agonist therapies, as well as safe supply
Mary and Chelsea talked about the Safe Supply Program through HamSmart in their presentation, so we also coordinate with that program. We have a partnership with St. Joseph's Healthcare, Womankind Withdrawal Management Services. So there's on-site support every night in the low barrier drop-in that the Safer Drug Use space is integrated into. We offer mental health support and gender-based violence safety planning. Just like in the first presentation, there's support through pregnant people who use drugs. And then we're also, we've become like a really fun space to do art. And we've included some pieces of art in this presentation already. And we are a really good community space for making connections between folks, which helps decrease people's isolation. And then we also make lots of referrals to healthcare and social services. Also, I am not a healthcare service provider of any kind, but we've now become people who are like pretty good at wound care out of necessity and out of like just knowing that people really need help with wound care and it's in the middle of the night, right? And folks are not gonna just wanna go to the hospital in the middle of the night to do that. So yeah, we do a lot of referrals, a lot of advocacy. We obviously partner with McMaster and we do a lot of community-based research projects, so that's been really great. So an integral part of our program is that it was conceived of and operates with the very intentional involvement of people with lived and living experience of drug use. So we have that partnership with Keeping Six. And Keeping Six does peer support training for people who use drugs, and you can be a peer support worker with Keeping Six and in the Safer Drug Use space if you actively use drugs still, and have no plans to not use drugs. So this is a way for people to really be supported by folks who have an understanding of what they're experiencing. There are peer-led groups every week in our space, and peer workers are on every shift. And this is another quote from my research project from someone who goes to SUS all the time, and we call it SUS, which is fun for people, staff and clients. So she said, I want to work here someday soon if I can, and that it would make her feel good to be able to do the stuff that we do and that the peer support staff do, because you know what, I do not personally have experience using drugs, and the number of times, I can't count the number of times I've felt so grateful to have peer support staff there who can explain things to me or identify experiences with people that helps that space be somewhere where it's not just like a very clinical, sterile environment. So anyway, very, very important to our program. And then just a few more quotes just to really emphasize the need for this space. Marianne said there's too many people overdosing. They need to come here to be close to somebody who's going to be able to help them. And then because we've become kind of like a community hub, Dawn said, was really grateful for the fact that we've been able to support her with her apartment hunting. She does have an apartment now. And we help, everyone there, service users, staff, everyone helped her hold on to that hope of finding housing.
So I'm just going to share briefly about our program statistics. And so we opened in April of 2022. We've seen approximately 242 unique guests since then. We see many of the same people access our space several times a week, even every night. On average, we have 16 people come through each evening. And over the past year, we've had a total of 4,895 visits to our site. Of those visits, 2,987 have been for the purposes of consuming an illicit drug on site, and 1,910 have been visits to access harm reduction supplies or other supports. We have saved the lives of 62 women and non-binary people within our space. We've only made 4 calls to EMS, and 1 person was transported to the hospital, and we have had no deaths. I will say our first line of defense, if there is a drug poisoning, is oxygen. So that keeps people coming back because we follow a medical directive, and we do wait as long as we can before we naloxone someone. So because we don't want to put people into immediate withdrawal. So through following that medical directive, we're able to respond with the oxygen. And we have used naloxone in our space, but typically we are using oxygen as a first response.
I can count on one hand how many times we've used naloxone because being able to use oxygen, it's a very effective intervention for drug poisonings because usually what we're first trying to do is address that someone's breathing's been depressed. In terms of areas for improvement, we're always taking feedback and always trying to adapt. What's kind of nice about being a program that doesn't have a lot of other programs to model after, and that we just kind of just came into because of sheer need, is that we've been able to be very flexible. But we want more activities. People love activities, and me included. I come in on my days off to join when there's something fun happening, which is always, and also our timing and the hours of operation. So right now we're only open when the drop-in's open, which is 10 p.m. to 1 p.m., but people don't stop using between 1 p.m. and 10 p.m. So it'd be really nice if 24 hours a day people could have access to this kind of hub, and it really is a funding issue. Something that Mary will get into a little bit when she's talking about actioning this in your work, is that being an urgent public health needs site, we don't receive government funding. So we have had to get that funding on our own. Another area for improvement would be more support for our peer support staff. Thank you. Part of it is that our peer support staff, because they're seconded to us from keeping six, we really think that there should be just more support in-house in the WCA to support. And then also, right now you can do a peer assist injection for someone only if you're not a peer support staff, the way the exemption with the government works. So we've had a lot of requests for peer support staff to be able to help with injections. Supervised inhalation, which is so hard. It's so hard to get an exemption to have supervised inhalation in-house, but people are experiencing more drug poisonings from smoking than injecting now, and then more GBV supports.
Okay. So YWCA Hamilton before the safer drug use space. So of course, drugs were prohibited inside the building. People were sometimes service restricted for using. Staff were calling paramedics 5 to 7 times a week. And this was all developing into a situation where there was a low trust between staff and between women who use drugs. There wasn't a lot of honest conversations happening about women's drug use and their needs relating to it. And as a result of responding to so many drug poisonings, service users and staff were experiencing trauma and burnout. We've really shifted this by opening our safer drug use space. And what we've seen is that a community-based response to the toxic drug crisis is possible. So before having this space, if there was a suspected drug poisoning, we didn't know how long ago it had happened or what the time frame was or what the substance was. Our immediate response was to start naloxone and call 911. The person was then taken to the emergency room to be monitored. Now, if a drug poisoning happens, it almost always happens in our space, of course, unless, of course, it's smoking. But staff can respond immediately with an understanding of what the substance was that the person was using. And we respond using O2 with their SAT monitor and naloxone when necessary. And then once the person regains consciousness, they'll be monitored in the safer drug use space. They don't need to go to the hospital to get monitored. Our staff can do that. So actioning this in your own work. So you first need to demonstrate that this is an urgent public health need happening within your organization or within your community and then within your organization. So collect and organize data relating to drug poisonings in and around your space. It was really important to us to develop a team, a team approach to doing this and a partnership approach to doing this. And our team includes a medical director who can sign off on our medical directive because we don't actually hire healthcare professionals to work in there. We don't have a nurse or anything like that. But because we are all trained under her medical directive, we can all use the oxygen and stuff. And also to hire people with lived experience and involve them as key members of that team. Seek funding. So this needs to be in place prior to applying for the exemption. The exemption office wants to know where your funding is coming from and how long you'll be able to operate if you got this exemption. You also need to have your space set up prior to applying for the exemption because they want you to, you apply for the exemption, then they want to tour your space. So prior to getting the exemption, you have to have everything set up. But the exemption is called an urgent public health needs site. The application to do it is quite easy, and we feel like a lot of community organizations maybe don't know about this route. It takes away a lot of the red tape associated with a CTS application, but the only barrier is that there's no funding attached to it. We have time for video.
No. So we don't have time for a video, but you can go on YouTube and check it out. The Canadian Drug Policy Coalition did a fun video with some folks in our space, including some of our peer support staff and a couple of clients. And just some final thoughts from Stacy. She said, it's actually, I think, a support. I think it does save people's lives, and I think it empowers them to just kind of be able to do it without feeling judged, without feeling any type of like negative consequence. And I think that's really important. Whereas there's other spaces that you just feel like somebody's getting an idea about you, but like here I feel completely whole. And thank you very much for listening today. And this picture is just from this zine that we work on in the space, Unsheltered the Zine. You can also Google it. Thanks so much.
Thank you, Mary and Stephanie, for your presentation, and thank you to all of our presenters here for sharing the important work that they do. We now have about 20 minutes for questions. We do have a microphone. If you do have a question, just put your hand up and a microphone will be brought to you, and you can ask the question to any of the presenters.
Thanks. I was just wondering about what stage the women who are pregnant come into the service, like how far along they are.
It really ranges. Typically, they're late in their pregnancy. Oftentimes, we're seeing that people aren't finding out they're pregnant until like 4 or 5 months along. Then sometimes they're coming in. Sometimes we're seeing people more coming in like way later in the pregnancy. We're also seeing some people coming into those beds after they've given birth, just for a short period of time for respite before they go back outside because perhaps their partner and them are living in an encampment. You know, we've had women who've had C-sections. They come in for respite and then go back outside. Thank you.
Hi, I might have missed this in the presentation, but with the women that you're supporting that are pregnant, that end up having their children, is there like advocacy and supports for court services and navigating CAS? And are those peers or people that have had experience, you know, like navigating the services themselves? Is there something like that set up?
That's a great question. And so right now there is advocacy with CAS. It is all done by Christine, the doula, but we are hoping for funding to build a peer support component into that role. Thank you.
Hi, this question is for Stephanie and Mary. I was just wondering if you could speak to if operating your safe consumption site kind of outside of provincial like regulation has impacted your relationships, whether funding or otherwise, with your kind of provincial government and your provincial regulators at all. I'm just speaking from like experience operating in Alberta, and harm reduction in Alberta is basically a bad word right now within our government context. So if you could shed any light on that, that would be really helpful. Thanks.
So as far as I know, No, but Mary deals with the like actual application part, but there's definitely like in the community at a community level like some negative feelings, not as much towards our program, but towards the CTS, because people might not have a great understanding of harm reduction. But Mary, yeah.
So I will just say, we don't operate outside of our provincial guidelines. Our exemption is federal. So it's not against like the provincial government to have it. And we haven't had any negative relationships with it. I think where we found that there was less pushback is because there already is so much drug use and such happening in and around our building. We're not trying to bring a new CTS into a community. We're trying to bring what's happening outside, inside, and just safer. So we haven't had any bad experiences.
And I think just perhaps we're also in a different political context in Ontario where harm reduction is supported at the provincial level and is like you can apply for funding for harm reduction services and to support that work. So yeah, we're lucky to have that support. Not everyone agrees, but.
I'm wondering, I've noticed that you're writing grants for your programs. I just am wondering what your plans are for sustainability of both the pregnancy program or the drug program. Are there possibilities for permanent funding for something like that? And maybe even the, and the ACT program as well. Thanks. These are great programs. Thanks for sharing all your experiences.
I don't think ongoing operational sustainable funding is necessarily available at anywhere at this point that we can find, but there's lots of different options and we're really creative in the ways that we piece together funding. So it is a lot of work just to get the programs funded. We leverage municipal funding where we can. So with they have some different calls for applications. We try to be really innovative in what we put forward. So we currently have, fingers crossed, an application in for family support services through through the city of Hamilton. So we're hoping that something like that would help support the reproductive care piece of work. And then for the Safer Use site, we work with we have a strong community foundation in Hamilton as well. So we leverage that for piecing together funding, but that is not sustainable or ongoing. That's when we're like, please, 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 we need to keep operating for the next year. Can you, provide us some funding? But we are also looking to the municipality for funding around that, looking to the province through some of their substance use and addiction programs funding to look at supporting some of the peer support work that we're doing. So really it's looking like where there might be opportunities and reaching out to different areas. So there's no ongoing operational funding that we can see. So we're always piecing together different pieces to try to make things happen.
Thank you. For the ACT project, unfortunately, we are not funded past March. So the hope is that our online learning center lives beyond us, even though the project is wrapping up.
We're also always really creative to integrate within the programs that exist. So more funding is always better. We want to have more support within the different programming. But as Mary mentioned, like with the reproductive care beds, we looked at what we had existing and tweaked it to ensure that we were meeting the needs of folks that we thought should be prioritized. So it would be much better if we had, additional funding to have additional beds to what we already provide, but because that's not available, we are able to kind of adjust things and fit it into our program. And the Safe Use site requires significant additional funding on top of our drop-in shelter funding, but it is like space-wise, it's embedded within a space that was recently renovated and funded through a different funding stream, so we have the space for it. Oh, no.
Oh, boy. Okay. This wraps this session up. Thank you very much, everyone.